After 70, missing these 3 body parts when you clean up can lead to odor, infection, even silent health issues. Most people skip them without knowing the risk. Stay until the very end, because the 3rd one is the most forgotten and the most dangerous. Hidden dangers. We need to begin with the conversation that too often gets pushed into the shadows, spoken about in hushed tones, or ignored entirely until a crisis forces our hand. It's about the subtle, almost invisible ways our bodies change as we journey through our 7th, 8th, and 9th decades. I want you to immediately erase the word decline from your mind. This is not a story of decline. This is a story of adaptation. It's about learning a new language that our body starts to speak, a language of new needs, new vulnerabilities, and new wisdom. When you're younger, your body is like a brand new car fresh off the lot, with a powerful engine, a flawless paint job, and that incredible new car smell of potential. It can handle a bit of mud on the tires, a long spontaneous road trip without an oil change, and it bounces back from a minor dent or a scratch with remarkable, almost unconscious resilience. The systems are robust, a finely tuned machine. The immune response is like a lightning-fast superhero, swooping in to vanquish any microbial threat before it can even establish a foothold. But as we accumulate years, as we gather wisdom, memories, and stories, that magnificent vehicle we inhabit changes. It evolves. It's now a cherished classic car. It has immense character. It has stories etched into its very frame. But it requires a different, more specialized kind of care, a more attentive, more gentle, more consistent kind of maintenance. Its systems, while still incredibly capable and beautiful, don't have the same wide buffer for neglect they once did. A small issue like a tiny patch of rust left untended can quietly spread and cascade into a much larger structural problem. This is the fundamental reality of aging, and it is absolutely nothing to be feared or ashamed of. It is something to be understood, respected, and most importantly, planned for. The hidden dangers we're discussing today aren't monstrous, unpredictable threats that appear out of the ether. They are the quiet, creeping consequences of not updating our personal maintenance plan to match the current specific needs of our body. They are the result of treating a classic car with the same thoughtless abandon you might treat a new one. Let's take your skin, for example. After the age of 70, the skin naturally becomes thinner, more delicate, a bit more like fine parchment than the resilient, thick canvas of your youth. The subcutaneous fatty layer beneath it, which acts as a protective cushion against bumps and bruises, diminishes. The production of collagen and elastin, the proteins that give skin its firmness and bounce, slows to a crawl. This means the skin's ability to stretch and snap back, and more importantly, to efficiently heal from a small cut or a scrape, is significantly reduced. Simultaneously, your circulation might not be as vigorous as it once was. The intricate network of blood vessels takes longer to deliver the vital, healing ingredients carried in your blood: oxygen, nutrients, immune cells, to the site of an injury. And your immune system, while still a powerful and wise protector, is a little slower on the draw. It doesn't respond with the same overwhelming immediate force it once did. It's more measured, more deliberate. None of these changes are failures. They are simply the new operational parameters of your body, the new rules of the game. And this is precisely why hygiene, which might have been a simple, thoughtless routine for decades, suddenly takes on a profound, new, and strategic importance. It's no longer just about feeling fresh or smelling nice. It graduates into a cornerstone of preventative health. It becomes a primary strategy for defending your fortress. The 3 areas we are going to explore today are the specific places where these changes, the thinner skin, the slower healing, the reduced circulation, the quieter immune system, converge to create a perfect storm of vulnerability. They are the areas where a tiny oversight, a brief moment of inattention, can become an entry point for a serious infection, a source of chronic, debilitating pain, and a direct threat to your mobility and your precious independence. Understanding this is the first, most crucial step. It's the mental shift from seeing hygiene as a mundane chore to seeing it as an act of profound self-care and strategic self-preservation. It's about honoring the incredible journey your body has been on and giving it exactly what it needs to carry you forward with strength, with comfort, and with dignity. This is the knowledge that empowers you. It is the information that moves you from being a passive passenger in your health journey to an active, engaged, and confident pilot. We are not here to fight against age. We are here to work in intelligent harmony with it. We are learning to listen to what our bodies are telling us and to respond with wisdom and care. The dangers are hidden only when we refuse to look. Today, we are turning on all the lights, and we are looking with clear, compassionate, and knowledgeable eyes. We're going to give you the map, showing you exactly where the risks lie, and more importantly, how to navigate them with simple, daily practices that hold the power to protect your entire well-being. This is not about adding a new burden to your day. It's about investing a few intentional minutes in a ritual that pays you back with priceless dividends, the currency of health, autonomy, and true peace of mind. Let's begin with the part of our body that is so often out of sight and out of mind, yet serves as the very base of our independent lives. Forgotten foundation. Let's talk about your feet. When was the last time you truly looked at them? I don't mean a fleeting glance as you pull on your socks or slip them into shoes. I mean a deliberate, careful, intentional inspection. For so many of us, for most of our lives, our feet are the forgotten foundation of our entire world. They bear the full weight of our bodies, our history, our ambitions, and the rhythm of our daily lives. They are our physical connection to the earth, granting us the miraculous freedom of movement. Yet they are so often the most neglected part of our anatomy, hidden away, ignored until they scream out in pain. After the age of 70, this pattern of gentle neglect can escalate into a serious, cascading threat to your health and your independence. What was once a minor, manageable issue can quickly become a major crisis. And it all starts with the simple act of washing, and just as importantly, the often rushed act of drying. The skin on our feet, like the rest of our body, becomes thinner and more fragile with age. But it's the dangerous combination of this fragility with other common age-related changes that creates a unique and potent vulnerability in this area. Many older adults experience decreased circulation in their lower extremities, a condition sometimes called peripheral artery disease. This means that the vital blood flow that delivers oxygen and nutrients essential for skin health and wound healing becomes sluggish and inefficient. A tiny cut from a jagged toenail, a small blister from a shoe that rubs in a new way, or a crack in the dry, calloused skin of the heel is no longer a trivial event. In a younger person, it would be a minor annoyance, healed and forgotten in a few days. But with compromised circulation, that same small wound can struggle desperately to heal. It can linger for weeks, even months, becoming a persistent open sore, an ulcer. For individuals living with diabetes, a condition all too common in the senior population, this risk is magnified exponentially. Diabetic neuropathy can diminish or even eliminate sensation in the feet. You may not even feel the initial injury, the pebble in your shoe, the blister forming on your heel. A small unfelt sore can then become dangerously infected. In the most tragic and severe cases, this can lead to catastrophic consequences, including gangrene and amputation. This is not a scare tactic. It is a heartbreaking reality that foot care specialists and wound care nurses face every single day. And its story so often begins with a simple lack of daily inspection. Then there is the ever-present threat of moisture. Our feet are often encased in socks and shoes, creating a warm, dark, and damp environment, the absolute perfect breeding ground for fungus. This is what leads to tinea pedis, more commonly known as athlete's foot, which presents as itchy, stinging, cracking, and peeling skin, typically between the toes. This is far more than a simple annoyance. Those painful cracks in the skin are breaches in your body's primary defense system. They are wide open doors for bacteria to waltz right in, leading to a serious secondary infection called cellulitis, a painful, red, swollen bacterial skin infection that can spread with alarming speed. Another common adversary is toenail fungus or onychomycosis. It can cause the nails to become thick, brittle, discolored, and crumbly. Beyond the cosmetic concern, thickened nails can be intensely painful. They press down on the delicate nail bed, creating constant pressure and making wearing normal shoes uncomfortable. This discomfort can subtly alter your gait and balance, which in turn significantly increases your risk of a fall. And as we know, a fall for an older adult can be a life-altering event, often marking the start of a rapid loss of independence. It can all be traced back, in a shocking number of cases, to something as seemingly simple as a fungal infection that took hold in a warm, damp, neglected environment. So, what does this mean in a practical day-to-day sense? It means that the daily washing of your feet with soap and water is non-negotiable. It is a foundational act of health. But the ritual cannot end there. The most critical step, the one that is most often overlooked, is the drying. You must take the time to dry your feet completely, paying special, meticulous attention to the small, tight spaces between each and every toe. This is where moisture loves to hide. This is where athlete's foot almost always gets its start. Use a soft, absorbent towel and gently pat the area dry. Never rub aggressively, as this can tear the fragile skin. After drying, take just 30 more seconds to simply look at your feet. Make it a routine. Look at the soles, the heels, the tops, and carefully inspect the spaces in between the toes. Are there any new red spots? Any blisters forming? Any new cracks or sores? Is there any change in color or temperature? This daily inspection is your personal early warning system. It allows you to catch a problem at its absolute earliest stage, when it is simple and easy to manage. If you have trouble reaching your feet, use a long-handled mirror placed on the floor to inspect the bottoms. If you see anything that concerns you, anything at all, don't wait for it to get worse. Speak to your doctor or a podiatrist immediately. This daily ritual, this intentional act of washing, meticulous drying, and careful inspection is one of the most powerful things you can do to protect your mobility and your freedom. Healthy feet allow you to walk with confidence, to engage in social activities, to go grocery shopping, to maintain your home, and to remain an active, vital participant in your own life. When foot pain or a serious infection takes hold, your world can shrink dramatically and with terrifying speed. It can become a world confined to a chair, a world dependent on others. By dedicating just 2 or 3 minutes a day to your forgotten foundation, you are making a powerful statement. You are saying that you value your freedom. You are saying that you honor the body that has carried you so far. You are taking a proactive, powerful step to ensure that your feet will continue to carry you into a future filled with activity, engagement, and independence. It is a simple act with the most profound of consequences: moisture traps. Now let's move our attention from the foundation of our body to its hidden corners, the places we often clean on autopilot, giving them a swish of soap without a second thought. I'm talking about the skin folds. Specifically, I'm referring to areas like the underarms, the groin, the area under the breasts for women, and for many older adults, the skin folds on the abdomen or between the thighs. These areas all have one thing in common: they are master moisture traps. Skin rests against skin, creating an environment that is constantly warm, dark, and often damp from perspiration. In our youth, with resilient skin and a robust immune system, this is rarely a major issue. But as we age, these innocent-looking folds can transform into danger zones. They become breeding grounds for a particularly miserable and painful condition called intertrigo, as well as a host of other opportunistic bacterial and fungal infections. And it's a problem that erodes not just the health of your skin, but your daily comfort, your confidence, and your overall quality of life. Intertrigo is, at its core, an inflammatory skin condition. It begins when moisture and friction conspire to chafe and irritate the skin. The first sign is usually a patch of bright red, raw-looking skin that might feel sore, tender, or have a burning sensation. It looks and feels like a simple rash, but because the environment is so incredibly hospitable to microorganisms, what starts as simple mechanical inflammation rarely stays that way for long. The warm, moist setting is a paradise for yeast, specifically the Candida fungus. the same culprit that causes thrush and other common yeast infections. It's also an ideal habitat for bacteria to flourish. So the initial rash very quickly becomes complicated by a secondary infection. The redness deepens, the area can become intensely itchy and exquisitely painful, and sometimes it can develop a foul, musty odor. The skin can begin to weep clear fluid, crack open, and peel. It's an agonizing condition that can make simple movements like walking, lifting your arms, or even getting dressed feel like a form of torture. It can make the very sensation of clothing against your skin unbearable. Why does this become so much more common and so much more severe after the age of 70? Once again, it comes back to the changes in our body's natural resilience. The skin's inherent barrier function, its ability to keep excess moisture out and irritants away, is not as robust as it used to be. The immune system's local surveillance team in the skin is a little less vigorous and slower to respond. Furthermore, new or worsening mobility issues can make it physically more difficult to clean and dry these areas thoroughly. If you have arthritis in your shoulders, reaching under your arms or your back might be a daily challenge. If you are carrying extra weight, you may have deeper skin folds that are harder to access and see. Underlying conditions, like diabetes, can also dramatically increase the risk, as higher blood sugar levels in the body can literally feed the growth of yeast. So you have a perfect storm brewing: a physically vulnerable area, a compromised skin barrier, a less responsive immune system, and potential physical challenges in performing the very hygiene required to prevent a problem. This is a condition that thrives in the dark, both literally and figuratively. People are often too embarrassed to talk about it with their families or even their doctors. They suffer in silence, trying a random assortment of over-the-counter creams that may not be appropriate for the specific type of infection, fungal or bacterial, that has taken hold. They might feel a deep sense of shame, as if it's a reflection of poor personal hygiene, when in reality, it is a medical condition born from the natural physiology of aging. The silence and the shame are the true enemies here. Openness and knowledge are your most powerful allies. The solution begins, as it did with our feet, with a new level of mindfulness in our daily cleansing ritual. It's not enough to just let soapy water run over these areas in the shower. You must gently, but purposefully, wash within the folds using a mild, pH-balanced soap. Harsh, heavily perfumed deodorant soaps can strip the skin of its natural protective oils, called the acid mantle, making it even more susceptible to irritation. After washing, the drying step is, once again, absolutely paramount. You cannot afford to have any lingering dampness. Pat the areas completely dry with a clean, soft towel. Remember, pat, don't rub. If you have deep folds, you might even consider using a hairdryer on its lowest, coolest setting to gently waft air into the area, ensuring it is perfectly and completely dry. This single step can be revolutionary in preventing recurrence. After drying, consider your clothing. Choose fabrics that are soft, natural, and breathable, like cotton or linen. Avoid synthetic fabrics like polyester or nylon for undergarments, as they trap moisture against the skin. For some individuals, using a specific moisture-absorbing powder can be helpful, but it's crucial to use the right kind. Avoid talc-based powders due to potential health concerns, and instead look for simple, unscented cornstarch-based powders. And here's a critical tip: never apply powder to damp skin. That just creates a pasty, clumpy mess that can make the problem even worse. Apply a light dusting of powder only to skin that is completely and totally dry. It acts as a silky barrier, absorbing any sweat that develops during the day. By paying this extra mindful attention to these hidden moisture traps, you are doing so much more than preventing a painful rash. You are preserving your physical comfort. You are protecting your ability to move freely and without pain. You are maintaining your confidence and your dignity. No one should have to suffer from a condition that is so highly preventable. It requires a small adjustment in your daily routine, a conscious shift from unconscious habit to conscious care. It's about understanding the unique needs of your skin as it is today, not as it was 30 years ago. It's a quiet, private act of self-respect that keeps you comfortable in your own skin, allowing you to focus on the people and activities that bring you joy, rather than being distracted by constant pain and irritation. This is a battle for comfort that you can win every single day. Oral gateway. We have tended to our foundation and secured our hidden corners. Now, we must turn our attention to what is arguably the most critical and often underestimated area in terms of its direct connection to our overall systemic health: the mouth. I call it the oral gateway for a very specific reason. Your mouth is not Las Vegas. What happens there does not stay there. It is the primary entrance to your digestive and respiratory tracts, and the health of this gateway has a direct, profound, and scientifically proven impact on the health of your entire body, especially your heart, your brain, and your lungs. Neglecting your oral health after the age of 70 is akin to leaving the main gate and all the doors of a fortress wide open for invaders to stroll right in. The consequences can be far more serious than a simple cavity or bad breath. We're talking about a significantly increased risk for heart disease, stroke, and pneumonia, three of the most significant and life-altering health threats to older adults. Let's first talk about the intimate link between your gums and your heart. Your gums, or gingiva, are teeming with blood vessels. When they are healthy, they form a tight, protective seal around your teeth, acting as a vigilant barrier that protects your bloodstream from the vast and complex ecosystem of bacteria living in your mouth. However, if oral hygiene is neglected, plaque, a sticky, colorless film of bacteria, inevitably builds up along the gum line. This buildup triggers an immune response called inflammation. The gums become red, swollen, tender, and may bleed when you brush. This initial stage is called gingivitis. If left untreated, gingivitis can progress to a much more serious and destructive form of gum disease called periodontitis. In periodontitis, the inflammation becomes chronic and relentless. The body's own inflammatory response, in its attempt to fight the bacteria, starts to break down the very bone and connective tissue that hold the teeth in place. The gums begin to pull away from the teeth, creating deep pockets. These pockets become dark, oxygen-deprived reservoirs for even more aggressive and dangerous bacteria. Now, you have a chronic, festering infection silently raging in your mouth. And because the gums are inflamed and bleeding, these harmful bacteria and the toxic, inflammatory byproducts they create can easily enter your bloodstream and travel throughout your body. Once in the bloodstream, these oral bacteria can travel to any organ or system. They can attach to the fatty plaques in the arteries of your heart, contributing to atherosclerosis or the hardening of the arteries. More importantly, the chronic inflammation triggered by the gum disease can promote and accelerate inflammation throughout your entire circulatory system. This systemic inflammation is now understood to be a key driver of cardiovascular disease, increasing the risk for blood clots, heart attack, and stroke. The evidence for this oral systemic link is overwhelming and no longer debated in medical circles. Taking care of your gums is, quite literally, a direct way of taking care of your heart. It is a powerful form of cardiovascular risk reduction that is entirely within your control. Another critical danger, especially for older adults who may be more frail or have medical conditions that cause difficulty swallowing, dysphagia, is aspiration pneumonia. This is a serious lung infection that develops when food, saliva, stomach acid, or liquids are breathed into the lungs instead of being swallowed into the stomach. The mouth is home to hundreds of species of bacteria. If oral hygiene is poor, the concentration of these bacteria, including harmful pathogens, increases dramatically. When tiny amounts of saliva containing this high bacterial load are accidentally aspirated into the lungs, something that can happen silently during sleep, especially in those with acid reflux, COPD, or neurological conditions, it can seed a dangerous and sometimes fatal infection. A clean mouth drastically reduces the number of harmful bacteria available to be aspirated. It turns a potential flood of pathogens into a manageable trickle that the lungs' own defense mechanisms can more easily handle. Therefore, a simple, thorough oral hygiene routine is one of your best and most accessible defenses against this life-threatening form of pneumonia. The challenge of maintaining oral health is amplified by one of the most common side effects of medications taken by older adults: dry mouth or xerostomia. Hundreds of common prescriptions for high blood pressure, depression, allergies, pain, incontinence, and more can reduce the production of saliva. Saliva is your mouth's natural superpower. It doesn't just moisten food for swallowing, it constantly washes away food particles. It neutralizes harmful acids produced by plaque bacteria, and it contains powerful enzymes and antibodies that fight infection. When saliva flow is reduced, this incredible natural defense system is crippled. The risk for rampant cavities, gum disease, and fungal infections like oral thrush skyrockets. The mouth feels constantly dry and uncomfortable, which can affect your ability to taste food, to chew properly, and to speak clearly. It is absolutely vital that if you suffer from dry mouth, you are even more meticulous and vigilant with your hygiene. This means brushing your teeth twice a day with a soft, bristled brush, and fluoride toothpaste is just the starting point. You must clean between your teeth daily using dental floss, interdental brushes, or a water flosser. This is where up to 40% of plaque hides and where gum disease almost always starts. But don't stop there. You must also clean your tongue. The tongue's rough, papilla-covered surface is a massive reservoir for bacteria and food debris. Use a dedicated tongue scraper or the back of your toothbrush to gently clean your tongue from back to front each day. If you wear full or partial dentures, they must be removed and cleaned thoroughly every single day and left out overnight to give your gum tissues a chance to rest and breathe. Dentures can harbor bacteria and fungi just like natural teeth and need their own cleaning routine. Caring for your oral gateway is not vanity. It is a fundamental practice of systemic disease prevention. It is a daily investment in the health of your heart, your brain, your lungs, and your entire body. It is a tangible commitment to reducing your risk for some of the most serious conditions that affect us as we age, empowering you to protect your systemic health from the inside out. Daily ritual. We've explored the forgotten foundation of your feet, the hidden moisture traps in your skin folds, and the critical oral gateway of your mouth. We've talked about the science, the risks, and the practical step-by-step methods for care. But now, I want to talk about the most important part of this entire discussion. It's the element that ties everything together and makes it sustainable. It's not about the soap, the towel, or the toothbrush. It's about your mind. It's about how we frame these actions. Because if you see these tasks as just another set of chores on a long list, as a burdensome and frustrating reminder of your age, they will feel heavy. They will be the first things you skip when you are tired or feeling down. But if we can shift our perspective, if we can consciously elevate these simple daily actions into a meaningful ritual, they become something else entirely. They become a source of strength. They become a quiet, daily declaration of your self-worth. A chore is something you do because you have to. It's often performed mindlessly, on autopilot, perhaps with a sigh of resignation. A ritual, on the other hand, is something you do with intention. It is a mindful practice, a physical action infused with purpose and meaning. Think about the profound difference. Rushing through a shower while your mind races with a dozen other worries is a chore. Taking a few extra moments to consciously and gently wash your feet, to carefully dry between your toes, to feel the warmth of the water and the scent of the soap, and to be grateful for the body that carries you. That is a ritual. Mindlessly brushing your teeth while you mentally compose your grocery list is a chore. Taking those same 2 minutes to purposefully clean each tooth surface, to floss between each tooth, to scrape your tongue, all while holding the understanding that you are actively protecting your heart and your lungs. That is a ritual. It is the intention, the awareness, and the purpose you bring to the moment that transforms the action from a burden into a gift. This transformation is not just a semantic game. It has a real, tangible psychological benefit. When you perform an action as a ritual of self-care, you are sending a powerful and consistent message to your subconscious mind. You are saying, I am worthy of this time. I am worthy of this dedicated care. My health matters. My comfort matters. My independence is precious and worth protecting. This regular, consistent affirmation of your own value can be incredibly grounding. It can boost your sense of agency and self-esteem in a world that can sometimes feel like it's moving too fast or leaving older adults behind. Creating these personal, empowering rituals is a way of reclaiming your control. It is a quiet, daily practice of putting yourself first, of honoring the magnificent vessel that has carried you through a lifetime of joys, sorrows, challenges, and triumphs. It is an act of profound and intimate respect for your own life's journey. It is a way to anchor yourself in the present moment, tending to the body you have right now with love and attention. These are not acts of defiance against aging. You cannot stop time, and frankly, you shouldn't want to. To age is a privilege denied to many, a testament to a life fully lived. This is about something far more sophisticated and beautiful. This is about working in an intelligent, harmonious partnership with the process of aging. It is about listening carefully to the new needs of your body and responding with wisdom, compassion, and diligence. It's about partnering with your body, not fighting against it as an adversary. When you inspect your feet for sores, you are not looking for failure or decay. You are acting as your body's most vigilant and loving guardian. When you carefully dry a skin fold, you are not surrendering to a perceived weakness. You are providing the precise, expert care your skin requires to remain healthy and intact. When you meticulously clean your gums, you are not just preventing a cavity. You are standing guard at the gateway to your systemic health, a warrior protecting the entire kingdom. These are acts of incredible strength, wisdom, and self-love. This isn't about fighting age. It's about honoring your body's incredible lifelong journey. These simple daily acts are not chores, but powerful rituals of self-respect. They are your tangible daily commitment to a life of dignity, comfort, and independence, proving to yourself over and over again that your well-being is always and has always been in your hands. This is the ultimate form of empowerment. It doesn't come from a magic pill or a doctor's procedure. It comes from you. It comes from the small, quiet, intentional choices you make in the private moments of your day. It is the powerful sum of these small, intentional acts that builds the fortress of a life of robust health and enduring independence. You hold the power every single day to protect yourself, to honor yourself, and to live with the grace, vitality, and peace of mind you so richly deserve. Let this knowledge not be a burden, but a liberation. A map and a set of tools you can use, starting today, to take the most compassionate and powerful care of the only you that you will ever have.